Agreed to, and I call the honourable member for Goldstein.
Well, thank you, Deputy Speaker. And I wish to commence where the previous Speaker finished and acknowledge the contribution of the member for Dunkley and her heartfelt and sincere contribution around what would be fair to say is the shadow pandemic, or the other side of the COVID-19 pandemic. And she's right on the regards to mammograms and breast cancer and whether people are accessing alternative treatments. But it's not just limited to breast cancer. It's the mental health impact, the shadow impact it's having on children's education, as people not getting other checkups that are having a direct impact on people's lives and likely to have a tail, which we will all experience, of preventable conditions and illnesses. And of course, tragically, in some cases, the shadow pandemic also includes the claiming of people's lives through mental health crises, all the way through, tragically, to suicide. And this is real for all of us. It's the reason why we want this pandemic to be over as soon as possible, but it also brings into focus the measures that are being taken throughout this pandemic and whether they're proportional and justified and do more harm than good. And the Prime Minister, in the context of the bill, has made the point about the critical role that the Doherty Institute modelling plays, and that there is a point at which lockdowns cause more harm than the good they do. There's an official modelled number from the Doherty Institute of 80%, but frankly I would contest that, not in suggesting that the Doherty model is wrong, but in the end I suspect it's much lower than that, because we already know that there is a trail of human tragedy, which is both on a health front, a lives front, and of course an economic front, that's experienced by many people from lockdown measures already. And I start unapologetically with a deep reticence of the idea that that should always be our first result of a policy measure. We've gone through an interesting journey as a country in learning. Last year, the reality is Alpha did meet its match against lockdowns, but this year lockdowns have met its match against Delta, and we need to be honest about that. And I know the member McArthur's injecting, he's welcome to do so. In a spirit of free debate, I don't change my view just because somebody has a different opinion. I welcome and celebrate diversity of opinion. But I do think we need to acknowledge that if we're going to have a sincere and honest conversation, but more critically, so that we're going to take the community with us on whatever the next step of this journey is. Because while I was talking before about the legislation we passed at the start of last year, as frankly, the world, not just Australia, looked into the abyss of the consequences of this pandemic. We are not at the end, and when we hit 80% vaccination rates, something I absolutely believe in very strongly, I'm already vaxxed, as I suspect most of the members of this chamber already are, that will not be the end. And we need to explain that to the public very clearly. But it does mean we will enter a new chapter. And we will enter a new chapter where, firstly, there's an expectation that people do get vaccinated and that they accept their sense of responsibility to get vaccinated. And I hear regularly people talking about rights and things like they don't feel they have a right not to get vaccinated. Well, I do sort of agree broadly. You do have a right to decide what goes in your body. I do agree with that proposition. But rights come with responsibilities. And if you care about yourself, which most people would hope that at least do as an first instance, but if you care about the others that you love and you care about, those in your family, your friendship circles and elsewhere, you will understand that getting vaccinated isn't just about protecting yourself, but it's about responsibility to others, the other side of the rights coin. And it's of critical importance that when that happens, we give Australians a pathway to make sure they can access the vaccines they need. And of course, there have been issues and delays with the rollout of the vaccine in Australia. No one's pretending otherwise. We initially hoped we would be able to produce a vaccine domestically at the University of Queensland. Unfortunately, that didn't work out after identified false positives for other conditions. We did hope that we were able to use domestically produced AstraZeneca vaccine, but because of various decisions, recommendations by ATAGI and the deliberate attempt by some, tragically, members of this House to undermine confidence in that, in a seeming desperate attempt for the vaccine rollout to fail, corroded public confidence. Make no mistake, I have always believed AstraZeneca is safe and people should get it, and frankly, I wish I could have got it. I have a very high degree of confidence in that vaccine, but at the time it was not available. And of course we have other vaccines that will come from the Moderna, obviously the Pfizer, and others that will continue to roll out over time. And this legislation is about saying, as we get that, and as people are starting to make the inquiries about boosters, and people have been, including the Goldstein constituency, that firstly we need to be clear, we have them on order. Boosters on order are going to start arriving towards the end of this year, that as any efficacy of a vaccine does wane, that those who need boosters will get them, and we need to empower the government to extend beyond its initial 6-month time frame to be able to order more vaccine and more boosters as time goes on. Because we don't know where this ends. And I've had conversations, including with the member for Macarthur outside of the chamber, I'm sure he won't mind me raising, in a very anodyne way, that we have had the Delta variant, but if you go on the WHO's website, it talks about other variants, and we don't know what the risks they are that pose, and of course what that means for our health, welfare and safety of the Australian people. And we need to empower the government to be able to do everything it can to back the Australian people who take responsibility for themselves and for those they love and they care about. And we sit in a dynamic environment where the mutations or variants that emerge will not necessarily originate in our country, and even with hefty quarantine measures, may not end in a situation where we can keep them out. And I always caution, and particularly when we look at some of the states who talk about sort of locking themselves off from the rest of the country, and I do understand their ambition to avoid the risks of COVID-19, I genuinely do. But the tragedy is the longer you create a gap between the live reality of the viruses that spread around the rest of the world and a population that has, does not have a full antibodies or immunities to it, the more you end up in a situation over time where the gap becomes larger and the impact can be much more devastating. And I said in a speech to this chamber earlier that this is one of the tragedies of what occurred in a European settlement in Australia in the latter part of the 18th century, where health viruses that were not previously exposed had an impact on a population who didn't have antibodies and then caused a terrible scourge. It's not the only basis in which we had a tragic loss of Aboriginal and Torres Strait Islander lives, but it has an impact, and the longer you let that gap grow, the bigger the impact it can have. So this government's about focus on what we need to do to get the population vaccinated. This government's committed not just doing it for today, but what we need to do for the future, and to continue to assist and adapt and provide the boosters that Australians need to protect themselves. But more critically, we need to do that swiftly, and if you haven't had a chance as a citizen of this country to go out and get your vaccine, please do so, and do so quickly, because the shadow pandemic, the physical conditions, the undiagnosed conditions, the education impacts, the mental health impacts, the life impacts that the member for Dunkley raised are too real, and frankly haven't been given the full consideration they deserve in a lot of the decisions that have been made, particularly by governments that have looked through matters through a singular focus. Thank you, Deputy Speaker.
Order. The